Stop sharing, and you got to turn it on.
Aloha. Thank you so much for joining us for today's webinar, Getting Keiki Back to School and Sports. My name is Dr. Jennifer King, and I'm here to facilitate today's conversation. This Hawaii Pacific Health webinar event is focused on safely reintegrating our keiki back to in-person school and sports and the mental and physical health factors to keep in mind. Now, we realize that some kids already did return yesterday, but a lot of these tips are going to be beneficial. Before we get started, there's a few reminders for our viewers. Today's webinar will be recorded. After the event is complete, registered participants will receive a copy of the recording, and the event will also be available to view on our social media channels and website. For those joining us live, please feel free to submit questions using the Q&A button at the bottom of your screen. We will do our best to answer as many questions as we can during the Q&A portion of the event. We are so very lucky to have several experts joining us for today's discussion. First, we have Dr. Chloe Edinger. She attended medical school at the Florida International University College of Medicine and completed her pediatric residency at the Nichols Children's Hospital. She currently works at the Straub Medical Center, Kapolei Clinic in urgent care as a pediatrician. Dr. Christopher Lynch attended the UC Davis School of Medicine and trained in pediatrics at the combined UC Irvine and Children's Hospital of Orange County residency program. He completed his sports medicine fellowship right here at the University of Hawaii and currently works for Kapiolani Bone and Joint Center. He's a team physician for UH Baseball and volunteers coverage for local high school athletics, both on the sideline during football season and throughout the year in several high school athletic training rooms on Oahu. And finally, Dr. Bart Pillen. He's a clinical psychologist who has worked with children and families in community mental health and medical settings throughout his career. He most recently serves as section chief for the Kapiolani Behavioral Health and Service. Thank you everyone for joining us. And we're going to start off with just some general questions and some tips for parents to have. So Dr. Edinger, I'll start with you and just kind of talk about what you've seen over the past year and a half, changes that COVID has brought to your patients in your office.
Yeah, I mean, and every parent has lived it day in and day out, and it's ultimately like the kids have sacrificed a lot for the global and good, and everyone's working really hard to keep their kids at home. And I think we've seen the kids sacrifice a lot of that in terms of their physical health and their mental health. And so we're really excited for them to get back out into the world.
I totally agree. You know, and we even see from the American Academy of Pediatrics that we really do want to get kids back to school because it's an important developmental, point for them. Dr. Lynch, with regards to activity levels, so we know that we don't want to go from 0 to hero. We do want kids to take their time. Can you talk a little bit about reintegrating kids back to physical activity again?
Absolutely. Activity levels were extremely different during the pandemic. Children and adolescents are now at vastly different levels of fitness, maturity, and growth compared to where they were just a year and a half ago. We cannot expect to return to 100%, as you say, immediately. We have to take our time. The process to redevelop the healthy routine needs to be individualized. We need to be flexible, adjust both our training difficulties as well as helping to navigate COVID regulations being relaxed or stepped up.
Yes, and I think we can all kind of see that kids have had huge growth spurts as well over the past year, and they have to kind of learn how to be in their bodies again too. So Dr. Pillen, like when we talk about the mental health aspect, we know that it's kind of normal for kids to be stressed and a little bit anxious. Can you expand on what we expect to see as kids reintegrate back into school, into sports?
Absolutely. Yeah, there have been so many changes, as previously mentioned, and the routines that we once relied on might be a little distant to us now. But I think to start where your children are at, the routines that you've continued with in your home life, but also your knowledge about your children, so that you would know kind of what their baseline behavior is and how they manage stress or transitions well, so they can use that as a ruler for their progress. Some of the things you'd want to watch out for, of course, is any sort of distress that might last for a long time and become more problematic, things that are not necessarily normal for your youngster, and intervene early so that the problems don't persist.
All great points.
Yeah.
Go ahead, Dr. Pillen, sorry.
Well, I know that there's a lot of concern, especially as children go back to school, about not just their physical safety, but emotional safety. You'd want to watch out, given their developmental stage. Are they acting out a little bit more? Are they becoming more frustrated? Do they pull back? Older kids, teenagers would be a little bit more surly or perhaps uncooperative, and might be a challenge to you. But one of the things that we know is that you can't scold away worries. You can't, criticize, sadness away. So you have to be patient and engage and be persistent and look for opportunities where you can really support your children a little bit more. We'll be speaking more about that.
Yeah, no, great points. And, every child is going to be different. Every teen is going to be different. So just to have a good gauge on where your kids are baseline, I think is really helpful to give them the support that they need. So Dr. Edinger, as we get Keiki back to school, I know some are on day 2 returning today. What are some tips that you've been sharing with your families and your patients?
So one thing is we always focus on the routines and building healthy habits into the routines and returning to routine, which obviously a lot of kids slipped away from. And I saw a lot of kids and parents saying, how am I going to get my teen to go back to school when they're used to like waking up, turning over and turning on the computer? And we have to set expectations, and we have to expect set expectations and also demand results from our kids, because I think a lot of the issues of coping that we did is we kind of let people cope the ways that they had to, and including our children and ourselves. And so we gave them a lot of easy way outs, but it's actually time that it is a healthy thing to demand expectations out of your teens, out of your children, and working to encourage all of those healthy habits.
Yes, and routines are huge. And I know anyone that's had toddlers definitely knows the importance of a routine for sure.
Our charts.
Yes. So Dr. Pillen, what are some other tips that you've been sharing with your patients as far as the mental health perspective?
Sure. I think I want to build on what Dr. Edinger was just mentioning, in that the routines are your foundation. But, this is nothing new. Even before the pandemic, parents teach their children to be safe and use good judgment. You put a helmet on when you get on your bike. You look both ways when you cross the street. So I would really encourage families to normalize these transitions, even now in the middle of this pandemic, so that you can kind of say, well, consistently, if you wash your hands and you kind of follow the expectations at school, if you're safe, you should really do a lot. And that's going to promote their good judgment, their self-efficacy, their ability to kind of manage themselves, right? I'll leave you with another example. Remember what it was like when we had fire drills in school? We didn't want the fire drill, but we practiced that. We practiced how we wanted to be in those rough moments, right? And I kind of enjoyed it when I was a kid. But so you'd want to approach practicing these solutions just in case there was something they needed to respond to. But more importantly, practice how success looks like for them as they go back to school.
Yeah, so we know that, that practice is so important, because the more it becomes more natural to them, then again, it goes back to getting into a routine.
Absolutely.
So I know when it comes to sports, we've had lots of attempts for Zoom workouts and things to keep kids active during this period where most of the sports were actually shut down. Dr. Lynch, what do you think about kids returning to sports? Are they at more risk for injury as they return post-COVID?
That certainly seems to be the valid concern. We're seeing a lot more injuries right now in our clinics due to overuse on the developing skeleton. People who haven't been pushing themselves as much suddenly reintegrate 3 or 4 sports at once, and that can lead to issues. The young athletes' bodies have grown and muscle memory has waned over the last year and a half. As sports medicine doctors, we usually love sports diversity, not specializing, but please, not all the sports at once. I encourage focusing on redeveloping that healthy routine rather than trying to make up for lost time with volume.
And it seems to be that the more we're looking at how long does it really take to reintegrate anyone, whether it's because they were shut down from sports or from an injury, it's about 2 months to get to
Yes.
pre-injury or pre-COVID, I guess, state for sure. So it does take some time. And I think telling the kids that it's normal is a good thing, because then that sets that expectation that we don't expect them to return for a week and then be back where they were prior to the shutdown.
Exactly. And making sure that they return in a stepwise process is key to that too, so they don't lose the progress that they did make.
Sounds perfect. So the other thing that has really been out of practice is social skills, right? So a lot of times you can kind of let go of your social skills when you're just hanging out with your family, but now that they're going to be back into social situations, Dr. Pillen, can you talk about some tips that parents can use for their kids?
Sure. A lot of times when we think about going back to school, we think the most about like academics and intelligence and doing well on spelling tests and math, assignments and stuff like that. But one of the biggest determinants of academic success is actually social and emotional intelligence. So problem solving, right? We teach our children how to solve a math problem, but we don't always pay attention to what happens when there's some sort of difficulty. You feel a little nervous going back to school, or you're not sure if you should raise your hand, right? So those are the sorts of things that you can anticipate and begin to brainstorm. So there's something called emotional problem solving skills that there's a lot of information out there for parents about how to coach your children on how to be successful, as opposed to just be frightened and back away. Find out what's motivating for them and try to piggyback on that. Try to utilize the things that they like to do and use that to encourage your children as a reward almost for having success. And then when they come back from school, talk to them not just about the problems, but the highlights of their day, what went well, because chances are they did something right, and you want to create these opportunities to reinforce them and praise them.
No, that's amazing information. And I think too, as parents, we're pretty good about the stranger danger and teaching them, what to do when they're approached by a stranger, or what to do when they're going to cross the street. But we probably aren't as good about coaching them as, what do you do if there's someone that's mean to you? How do you respond to that? And how do you kind of go about troubleshooting those kinds of situations? So those are all great points. So obviously kids are both nervous and excited, and probably bounce back and forth between nervousness and excitement about being back in school. Dr. Edinger, what are some points that you've been giving your patients as far as that return back to in-person learning?
Yeah, and we have seen probably some patients that every personality is slightly different. And some of those kiddos that are on the more anxious side, in reality, they've received a lot of reason to be anxious. And we've given them a lot of fear, to be honest, because their whole way they experience the world, from licking everything that they saw to wearing masks, has changed. And so I think we have discussed, reinforcing the message of how much we've all done to keep them safe, and how much they're doing for themselves to keep them safe, and normalizing their feeling, because it's not rooted in something very real. But that doesn't mean we don't have like power and agency to like keep ourselves safe, because we have a lot of options.
I totally agree. And it's interesting because I remember one of the best kindergarten teacher advice I had when my kids were in kindergarten was, when you make a mistake, say it out loud, right? Oops, I made a mistake and this is how I'm going to fix it. And safety is the same, right? So when you're leaving and you say, okay, I'm going to make sure I sanitize my hands because that's how I'm keeping myself safe. So verbalizing what you're doing in your routine, I think, especially for younger kids, can be really helpful.
And I would say it's the most impressive thing is that the kids all come into the offices, I'm sure you've seen in your offices, obsessed with washing their hands. They're better at it than I've ever seen ever in my life. So it's pretty impressive what they've all learned.
Yeah, and they're so much more adaptable than adults, because my kids don't complain about a mask. They just know it's just something that they have to do. So they're, really impressive human beings. Sometimes we don't give them enough credit, I think.
Yeah.
My 18-month-old asks for hand sanitizer whenever we go through the front door. So yes.
They learn.
Yes. Okay, and then even though we know that there's a normal level of nervousness and a normal level of anxiety, for some kids, it's going to kind of cross that threshold when they may need some additional support. So Dr. Pillen, can you talk about what symptoms or signs you would see in kids that maybe they should start reaching out for some additional care?
Absolutely. Again, the baseline is your knowledge about your child and how they manage stressful situations or changes like starting school. But in situations where you have worries about their behavior, their adjustment, their kind of reaction to their acting out, or they're becoming more withdrawn for longer than a few days, you want to pay attention to that and intervene and begin to try to take opportunities to check in. You don't want it to get worse and worse. It shouldn't have to be somebody's in crisis before you respond to that. For younger children, they tend to, act out and be emotional, or even temper tantrums sometimes, or they shut down and they're not interested in things. For older kids, they withdraw, they get stuck in their phone or on the computer for way too long and disengage from family members. And of course, then if you see, like, especially as they go back to school, abrupt changes in their behavior, or that they're usually do well in academics and they're just not doing well, they're really faltering or failing, those are signs behaviorally that you need to go get some help and check it out with your pediatrician or family doc or friendly psychologist. Okay. Certainly, if there's any sort of concern about self-harm, self-injury, I wish I wasn't alive, that's where you get immediate help. And do not hesitate to call your physician or some of the resources we'll be talking about later on. Okay.
Yes, and something a colleague had shared with me before was that what she recommends is that in the beginning of the school year, the kids identify a safe adult that's not their parent, right? Because sometimes when they have these feelings, they're a little bit apprehensive about sharing it with their parents, but they may tell either a teacher or a counselor or an auntie or someone else that's not their parent too. So I think sometimes empowering them to pick a go-to person can be helpful, that they have a resource for themselves as well.
Absolutely.
And then have you seen an increase in anxiety and depression throughout the pandemic?
Oh, yes. Unfortunately, I think that's true for adults and for children, but sticking with the children and the teenagers, we've seen a dramatic increase in, calls to our offices, calls to crisis hotlines, people who present to the emergency department. And so we know that there are a number of factors. One is if there's existing concerns about depression or anxiety for our youngsters, the pandemic certainly has not helped that. It's probably magnified those things. Isolation has had a dramatic impact on teenagers especially. So if you know that through the course of this pandemic, you have seen this kind of gradual increase in distress by your children, it's important for you to respond to that sooner rather than later. And I really agree. There are lots of resources in school, at home, maybe a favorite auntie that you'd want to tap into, and certainly us professionals as well.
And definitely, I think we knew this prior to the pandemic, but teenagers are not meant to be with their parents 24/7. It's been really, really hard for them, I think, for the past year. So
Yeah.
I'm excited for them to be able to get back into their social circles again. Okay, so getting back into sports, Dr. Lynch, are there any sports that seem to be safer to reintegrate to as opposed to others?
I believe the intent of this question is injury safety rather than COVID exposure risk, but I can speak to both. There are a couple of factors to think about with return to play. Athletes are simply deconditioned and out of shape at this point, but they also haven't been recreating the biomechanical pathways. Their muscle memory has evaporated over the last year and a half. It stands to reason that the less technical and lower impact sports, jogging, biking, swimming, will have different injury profiles during reintegration rather than what you'd see in an advanced gymnast or in a baseball pitcher. There isn't one single sport that's going to be perfect for all upon return, but almost all sports have basic elements to them that can be safely reattempted and progressively built upon. That isn't to say that there won't be pain. As one of my colleagues likes to say, there's okay pain and there's not okay pain. Okay pain would be gradually worsening, widely spread out, large muscle soreness. It's to be expected during and after workouts. That's generally okay. Sudden pain in one location or severe pain that's resulting in limping, changing the way you play your sport or function in everyday life is generally not okay and may indicate the need for additional assessment. In terms of COVID exposure by sport, there's a resource for that. The Aspen Institute published a COVID-19 risk assessment tool last year, but it still has some valid key points to it. And to summarize their expert opinion, sports that involve solo training, non-shared equipment, permit distancing, involve less rest than team athletics. But there are also ways to train for almost all sports, even the team sports, that mitigate the inherent risk. And they break down every sport from golf to football to parkour to the lowest, medium, and highest risk components. That said, over the last year, it has become clear that the biggest risk of transmission is tied to locker rooms, team gatherings, sideline, rather than on-field participation.
And we do love our potlucks, right? And so that's been a really big change for sports after the practices are done. So I think definitely that's been a change in our culture, but hopefully temporary. And then we'll get back to them as soon as it's safe to do so as well. So I know that parents are going to be checking in on their kids as far as if they're injured or having pain related to sports, but then we also want to check in on them with how they're doing socially and emotionally upon return as well. So Dr. Pilling, can you talk about how to check in with the kids without being that completely hovering parent that gives their their kids the third degree every time they have something going on at school?
Yeah, I think it's important to take a developmental frame. And so I'll start with the youngsters first, the really younger children. You have a lot of contact with children there as they go to school and come back from school. It's really important to kind of check in with them on, at certain milestones of the day, if you will. It might be for your child at bedtime, or it might be, before you turn on the TV or as you're driving home from work. But find some ways to kind of sprinkle in questions about how things have gone for them, and particularly pay attention to things that they've done well, so you can make a big deal and really reinforce them. I'll jump to the teenagers. A lot of times they'll shrug their shoulders and maybe say it was okay. I discovered that with my kids when they were teenagers, that driving was the magic trick, or going on a hike where they didn't have their phones necessarily. I would take the long route home just so that they would get to talking a little bit more. So you want to look at those milestones in the day where they're more likely to engage with you, and then linger over that. Of course, with teenagers, if you are worried, you might need to be insistent and sit them down and say, hey, tell me how things are going. But again, be balanced. For those middle schoolers, it's always a bit different because it's such a transition period. I know we've gone through so many changes already. Try to think about, especially for, like middle school children, kids who are a little bit later in elementary school, what can you negotiate with them? Certainly there are decisions that parents make, decisions kids can make on their own, but it's those negotiated decisions, especially if a child wants to do something, that's motivating. So say, hey, talk to me about it. And it's this opportunity to discuss decision-making and being safe and judgment. You can really kind of check in on their emotions. So look at the things they really want to do or love to do and try to have that kind of dialogue with them. Those are good opportunities.
That's fantastic. And then do you have any good resources for parents that do need to reach out for a little bit more support, or even the kids?
So yeah, there are a lot of good resources. At the school, I know that there are certain resources available, student counselors, student services representatives, the teachers. In the mental health field, I think I would probably start with primary care and talking to the doctor about these sorts of things in case referral to a child psychologist might be important, or a child psychiatrist. There are certainly resources available for urgent situations. The Hawaii Department of Health has a CARES line, or it used to be called the Access Line. It's 24/7, but it's much more than like a crisis line. They really have a lot of great resources available and support for parents as well as youngsters. And of course, there are situations that come up unexpectedly, perhaps, but that are critical. And so things like the National Suicide Prevention Line or the crisis text line that a lot of teenagers like to use is much more available and ready for those situations. Certainly our service is available as well. And we work with a lot of people through Kapi'olani Hospital and the other sites through HPH.
No, those are great resources to have, and definitely keep them somewhere safe so you can refer to them. And then also with the pandemic, we've noticed that things change all the time. So even all the topics we're talking about today may change as early as tomorrow, just because there's been a lot of pivoting that's happened over the past 2 years. So I'm sure that with the DOE as well, there's a lot of changes that occur. Dr. Edinger, could you share some resources that parents can look for the most up-to-date information regarding school?
Yes, so the DOE does have a website. We will share that as well, where they keep posting their updates and policies, which, it's obviously very quick turnaround. They have a health hotline if you have a question about your child and what to do if that kid has a sniffly nose. Ultimately, we do have to change the way we send kids to school. And that's something I didn't touch on earlier, but we used to just send them, or if they have a fever, give them Tylenol and say, get through it, push through it. But now we have to think on the community level. And so when that kid goes to school with the runny nose or the fever, and other kids end up getting sick, even though we don't know we don't think it's COVID, we don't know. And then we can trigger a cascade of testing and things like that. So we have to be a little bit more flexible in keeping kids home and creating that relationship with your pediatrician, as well as, unfortunately, there may be a little bit more testing in the pediatric population, to be quite honest, right now, especially with the numbers being the way they are. So it's definitely going to be all about a lot more flexibility and returning to school as soon as possible, safely.
No, perfect. And we will share these slides with everyone that is listening to the webinar in our big mahalo email at the end as well. As far as talking about sending kids to school with sniffles was what we used to do, we probably did the same for sports, right? And so Dr. Lynch, can you talk about what you would do if someone on the team tests positive for COVID?
Absolutely. There are two angles there on how we handle the protection of the team from the exposure, and then also how do we return a COVID positive athlete back safely. And make no mistake, there will be and there already are positives in our athletes right here on island. And so we will continue to utilize everything that we have here. Courtney, if you wouldn't mind sharing my slide there. This opening slide demonstrates what we do with a COVID positive result when it is confirmed. First and foremost, we have to follow the Hawaii Department of Health guidelines and remove that individual from play and trace anyone that they had close contacts with, complete all necessary forms to protect the rest of the team. They have to rest for 10 days and be asymptomatic without any medications on board. And they also need to check in with their PCP. Their primary care provider is going to be key in terms of governing what else needs to be done, whether that needs to be additional heart or lung screenings, or if they're going to be able to return to play right off of where they are once they're asymptomatic. Once that determination is made, we recommend gradual return, and we'll get into what that 7 days looks like here in a second. If they are from a Department of Educationally mediated school, there's a medical referral form that's going to be needed to be completed by the athletic trainer and sent as well to the PCP. Next slide. This is a rather busy slide, I'll admit, but it highlights what primary care doctors are considering to avoid complications in athletes returning to play. And it underlies the importance of really creating that relationship with your primary doctor and checking in with them once the infection is confirmed. Of note, those with more severe symptomatic infections, you can see we grade them by asymptomatic or minimally to moderate all the way up to severe. They might require a cardiac assessment, heart assessment prior to return, because of some of the complications that can arise from the more severe infections. It's an important piece to discuss with your primary care provider. Next slide. once cleared a gradual progression back to full speed athletics over about 7 days is advisable. This is very similar to what we would do post-concussion, and gives the idea of a gradual return and allowing any symptoms that may be lingering to show themselves before full play becomes the normal for them. The protocol you see here is based off of the British Journal of Sports Medicine that was published last year and then was subsequently endorsed by the American Academy of Pediatrics. There continues to be a discussion of changes to the format, but for now, these preceding 3 slides remain our standard, and we will continue to update them as the cases change.
No, thank you so much. And they've been pretty steady with these guidelines whenever they came out in this past spring. So they seem to be pretty solid, even with the changes in the infection rates in the community. And just a little tidbit too, I know we didn't have this as part of our discussion, but there was some concern because post-vaccine for the 12 and over, there was an incidence of myocarditis that happened with those kids after they had their vaccine. And just to kind of share with everyone, it's a very, very mild form of myocarditis, and kids recover very quickly. So independent of that risk of myocarditis, you know, the risk of getting COVID and being more ill than that is a lot higher than getting the vaccine. So we do still strongly recommend the vaccine for the 12 and over group. For that, it's approved for right now. Along with our pivoting conversations that we've been having throughout this talk, I think part of it is for the parents to also remain adaptable. So Dr. Pillen, can you talk about how that can help the kids when the parents really model that type of behavior?
Absolutely. Unfortunately, there's no class in school about how to cope with a lot of these situations. And certainly there has been no manual for a pandemic, right? But fundamentally, how we teach our children to adapt to stress, adapt to changes, cope and problem solve, that comes from mom and dad or other family members as well. So I think the message about taking good care of your children, the parallel to that is you got to take care of yourself, monitor your own emotions, and then begin to say, well, what am I going to teach my child today about managing this well? And they can read your expressions, they know your body language. So you have to be very deliberate. I would be thinking about, like, if a stressful moment comes up sometime today, how would you like to be? How would you like to demonstrate? How many different options can you, explain to your child? There's this book called I Can Problem Solve, or Raising a Thinking Child, that's been around since the 1990s, based on some excellent research about how to do emotional problem solving and coach your children on how to deal with anxiety, worries, or the like. And so that's a good resource. But ultimately, if you only talk about the problem, you're going to be in trouble. That's like rehearsing anxiety or rehearsing depression, right? So you want to talk about the problem, find out what's happening with your child, and then turn to this problem-solving approach. How many different ways can you soothe, problem solve, access help, make good decisions? So run through those scenarios in your life and in your family, and then share them with your children.
No, great tips. And as parents are huge role models in their child's life, also if you have a young athlete, the coaches also are a huge role model for these kids too. So they play a huge role in really setting an example. Dr. Lynch, can you talk about what parents should keep in mind regarding others who may want to push their children from zero to hero as they get back to sports, and how to have conversations with coaches and other team members?
That's a great question. I've actually, going a little off script here, but I've actually been rather impressed in the last week about what I've heard about various coaches. There's been a couple of examples I can think of off the top of my head of them really taking into account the need for cross training, the differing levels of fitness that people are coming back in with, the importance of creating a community that they're getting back to, and following all of the local mandates and restrictions that are necessary for COVID at this point. I've been impressed. That made me feel really good to hear from a number of my patients. However, as the saying goes, when you're a hammer, all you can see is nails. Many coaches and trainers are dying to get teams back to where they were before. They're overseeing student athletes who are also chomping at the bit to get back to where they were. Parents and practitioners, we have to walk that fine line in encouraging healthy participation, but also tempering the immediate expectations. and focusing on the process.
Sounds great. And I know that this is kind of a little plug for our state, but if your child is in high school sports, you actually have athletic trainers available to you from the school, who is also a great resource. You know, if the kids are feeling like they need a little bit of help, or they're not sure if this is an okay pain or a not okay pain, Hawaii is one of the few states that has that luxury of having athletic trainers in every school. So that's always a good piece of information to know, where you can get some support as well. So I know we've talked a lot about both physical health, mental health, social, emotional health in our kids. So Dr. Edinger, could you kind of bring it all home and kind of talk about some important things just with lifestyle management for kids as they return to school?
Yes, and actually some of this touches on health for weathering COVID, to be quite honest. And that's something that I hate to even talk about, but it's real life. And so we know that healthier bodies can sometimes, there are things that can fight better, right? So we know obesity is a risk factor for severe COVID in pediatrics. And so really engaging the family to work on making healthy life choices, and learning about nutrition, focusing on exercise, and it has to be a whole family thing together, and a commitment, like together. It's not easy, and I always understand that, and I deeply respect how complicated it is to raise a family in modern life, especially when we're all working really hard and it's hard to get home and do all these things. But just slowly working on that, it is crucial, and it is life-saving and is important. So it's hard, it's not easy, but it's worth it.
Yes, and I think, you know, it's important to keep in mind that every day is a new day. So, I mean, some days aren't going to be so great, and there's not going to be the best nutrition choices, but then
100%.
the next day you just start over again, right?
100%.
Yes.
I think we have to have a lot of like softness with ourselves, but also expectations. And that's, I think, what allows you to create behavioral change and healthy lifestyles.
Yes, and even when we give something like home exercises to our patients, you know, I always have this spiel where I would love for you to do this every day. I hope for 5 days a week. But then, you know, the day that you miss, the next day you're going to say, okay, I'm going to get on it again. And that's the same with any kind of lifestyle change.
Yeah.
Okay, Dr. Lynch, can you talk about a little bit about overuse and recovery? Because I think going forward for the deconditioned kids, we're just going to see them at risk for overuse injuries.
Absolutely, and we've already given overuse its due face time in this particular call. On the other side of that coin, and equally important, is the recovery elements. We need to make sure that they're getting adequate food, dietary support, making sure the hydration remains something that they are thinking about and they're bringing to practices. Additionally, in the evenings, making sure that we are trying to find ways to reduce stress, to allow them to sleep better. As we get into the school year, that's just going to be more important, and it comes with creating that healthy routine. That's going to help to overcome some of the issues related to overuse in terms of the recovery.
No, fantastic, for sure. And then we're learning more about the mind-gut relationship too, right? So even for mental health, we really know that having nutrition at a good baseline is really helpful for a lot of mental health issues too.
Yeah, and I kind of didn't mention, but I know a lot of people struggled with the electronics, and a lot of kids struggling with, especially the older ones, with the hygiene for bedtime routines. I cannot emphasize like enough, like removing electronics, because again, a lot of kids have gotten to the point where they think they deserve it and need it to live and breathe. But it is your job as a parent, unfortunately, sometimes to do the things that, right, we've always done this. We've always done things that they don't like to do as a form of effective parenting. And so getting those screens out of their hands is completely within your right as a parent, and completely within your like active to help them, you know, get to have better, healthier sleep routines. And I've just seen a lot of teenagers that are sleeping like 5 hours a night because they're going to bed at like 2 a.m, watching Netflix all night long. And you think about your teenage years, it just wasn't an option for you.
Right. As I used to say, back in the caveman days, sun went down, humans slept. There was nothing else to do, right?
Yeah.
And I promise you're not going to finish the internet tonight. So you might as well just put it down and then be able to go on with your day. And I think the transitions are the hardest, like actually getting them off the electronics to do something.
Yeah.
That is definitely the hardest thing, because once they're
easy.
doing it and engaged,
they're happy.
fine.
Yeah, it's not great. There's some tricks, that you can always do, and modeling. I have a lot of parents that complain about their kid being on the phone all the time while they're not looking me in the eye and text and like playing. So we have to do it all together as a group. It's just not easy. It's a big transition.
And I do utilize a technology. I mean, having screen time that I can just shut it off. So I'm not the mean person saying, get off your electronics. And then, when they were little, you get away with, oh, the Wi-Fi must be out. But now they do know that it's me shutting it down, but it helps sometimes with that transition of getting them to move on to the next activity.
Yep.
Okay, so I think we have some time for some Q&A, and we have some wonderful questions. We are definitely going to try to get to as many as we can as possible. And we have some that were submitted when they registered. And then thank you so much for submitting them early. And then also some that are coming online now. So I'll jump back and forth between the two. My first one, so maybe both Dr. Pillen and Dr. Lynch can comment on this one. So any suggestions to motivate children to return to sport activities post-COVID? Dr. Lynch, do you want to start?
Sure, absolutely. It certainly depends on the age and the demeanor of the child. You are the professional for your own child and what motivates them. And the younger age range, it's usually as simple as creating the space for them to have that activity, whether it be taking them outside to the park when you're able to do so. Noticing things with my own daughter, she will watch the Olympics with me from the couch if I turn it on. But if I turn down the music, I turn on the horses portion of it, and I turn on a certain playlist on Google, then she'll dance the whole time until I turn it off. And it takes sometimes knowing those kind of activity levels with your children. Once you get up to the Minecraft, Fortnite ages, it becomes a little bit harder to tear them away. And within your bubble, within your comfort level for COVID exposure, of course, creating the social engagement, bringing a ball with you, going to the park and making sure that you've got the opportunities available to them to be able to put those electronics down is a key piece of that motivating factor.
Fantastic. Dr. Pillen?
Yeah, building on that, I think we all would agree as parents that it's the transitions that are the hard part. Putting down the phone, turning off the TV, shutting down the computer. Once our kids get going in an activity, they're usually very happy, and we would hope that it would be its own reward, right? So how do you want to insert these kind of interruptions, if you will? There's the principle in psychology where if you take any high frequency activity, like being on your phone, for example, and it keeps happening, and you make that the reward as opposed to some God-given right, what you want to do is you want to put a reasonable limit. Okay, in 2 hours, we're going to stop watching TV, and then we're going to do something else. And the quality of how you do that, if you have a great attitude, you cooperate, we have a great time, then we'll consider adding additional time on the computer or the phone or whatever. Okay, use these things as rewards. Okay, but you want to create these opportunities for these other activities where people get up, move their bodies, talk story. I love the example of, changing the mood with some music and dance. That's very creative. So I'd encourage parents to get creative like that.
Sounds fantastic. So the next question I definitely wanted to make sure that we touched up on because I think it's important. So Dr. Edinger, can you talk about, is it okay for kids to wear face masks and, face shields instead of face masks when they're in school?
So face shields are not an appropriate substitute for face masks, and we had some molecular studies that also showed the movement of particles differently. So face masks are certainly the only acceptable covering.
Perfect, sounds great. And then Dr. Lynch, this one's for you. Are swimming classes safe during the pandemic?
Like we touched on before, usually once the activity is actually occurring, there seems to be little risk of transmission during that activity. So safe is a tricky word because there is going to be inherent risk in any of these activities, but there's probably as much of a risk in hanging out around the pool and getting your child into that pool as there is during the actual lesson, provided that the people that you're getting the lessons from are also following all due precautions and they're off time. My own daughter is participating in swim lessons. So yes, there is the risk is mitigatable in my opinion.
Sounds great. Okay, and then this one, I'll start with you, Dr. Edinger, but Dr. Pillen may have something to say about this as well. So we have questions about sleep hygiene and the use of melatonin in youth.
Well, just in terms of sleep hygiene, starting the routine and looking at all different parts of your routine before the melatonin use, I would say is the most important thing, because you can't, it's like a Band-Aid if you don't change those other pieces. That doesn't mean it's not a safe treatment in the situation that it is indicated and in discussion with your physician, but the routines have to be in place in conjunction. That's all I have.
Okay. I can add a little bit to that. Building onto the routines, which I think is very, very important. You know, you have to adhere to that. So the more consistent you could set a great bedtime, these sorts of things. And more importantly, it's hard if you've had a very, very busy day, for example, to quiet down the body, get the mind to be restless. So that's why, like with younger kids, we have bedtime routines. We do something soothing, right? And we do this with our children and we model that for them. So by extension, before you would use a sleep aid necessarily, and I do this with adults, by the way, I would say, let's practice a relaxation technique. Let's do deep breathing. Let's find the most quiet, calmest part of your body. Is it your little toe on your right foot? And get in. As soon as the mind goes into a relaxation mode, say like with a soothing book or image, these sorts of things, then the body knows what to do. You know, your body, you can't think yourself to sleep. You have to relax yourself into sleep. So I always encourage parents to do this with their children. It's a pleasant memory to create. It helps them to get not only the kind of the routines of sleep in place, but kind of a mindset of coming to rest, replenishing, and that can last a lifetime.
Great tips. And the other recommendation I try to give too is that if there's a possibility of them getting out in the sunlight for about 15 minutes between 7 and 8 a.m., that can help to set their circadian rhythm for the day. And then oftentimes if they can do that, then their brain already goes into a rhythm. And then for the rest of the day, they have set that for that particular day. So that would be the other tip that I often give patients that are having trouble falling asleep. Okay, so the next question I was going to take only because I have a child in band. And so someone had asked, are there any recommendations specific to marching band? So it's so interesting that the National Federation of High School Sports actually started to study band and singing as well as athletes to see what the risk was as far as practicing in indoor spaces. And so I think for marching band, it's just the same thing. It's just taking those extra steps to make sure that everyone is safe. They actually make face masks with the puka in the mask for the wind instruments. And then there's an additional mask that goes on the outside of the instrument. So that's been helpful to mitigate practices of the wind instruments. And then obviously for string or percussion, they can actually just wear the masks. And so there is a lot of information on the National Federation of High School website that's specific for marching band, and it does follow what your local tiers are doing as well, as far as how many people are able to gather for practices. So Dr. Pillen, we have another question about what do you advise parents if kids show a lot of stress and a lot of hesitation returning to school?
So you need to take this in a stepwise fashion. You certainly don't want to force your children into a situation where their anxiety or their stress is going to escalate. So practice how you want to play, just like my sports colleagues are saying. You know, you want to begin to, especially if it's an event like going to school, starting a particular routine. what you want to do is you want to begin to rehearse that and talk about how many different ways. Again, this emotional problem solving is really important. I would suggest to you, though, that especially with children who are demonstrating a lot of anxiety, as well as us adults, that it is more a behavior thing rather than talking. There's this tendency for us adults, especially with verbally, adept kids, to over talk it. You want to talk about the solution and what can be done, and then get people to walk through it. You can hit the pause button if the distress gets up a little high, retreat a little bit, but don't say, I'm done with this. Come back and keep making stepwise progress. We call that systematic desensitization in our business, and it works like a charm. That's very helpful.
Great advice. Dr. Lynch, the next question I think is going to be geared towards you. Is it safe to play soccer without a mask?
I'm going to be very careful in how I answer this question. The short answer is no. In this situation, the recommendation would be to wear a mask, but that is not to say that wearing a mask will make it necessarily safe. There is risk mitigation, and there is going to be risk, personal decision, a family decision of what kind of acceptable risk is for your family in terms of returning to everything right now. Wearing the mask is in line with CDC recommendations. I think we all read some of the recommendations and said, oh, sweet, I can run outside without a mask on. This is awesome. But if you read them a little bit more in depth, the most up-to-date ones as of today still include a lot of other points with that kind of soften it. First of all, the numbers. Those numbers are not where they were when those recommendations came out. We had nearly 400 cases yesterday. Nearly 6% of the tests were positive, I think. Those numbers are not where they were when those recommendations came down. Additionally, these are groups of larger than the numbers that were posted previously, and we have no way of knowing whether everyone in those groups are vaccinated. And in some cases, they're under 12, so there's no way that they are vaccinated. All these things together make the mask mandate a key piece, but your decision-making to go out is going to be based on the risk of how safe you can keep your own child, how safe you feel like the team environment or the group environment is, and additionally, the prevailing frequency of infection in the community. And as of 2 weeks ago, it was looking all right, but as of today, you may have a different decision.
Mm-hmm.
No, I completely agree. And since we know that if you're under 12, you can't get the vaccine, it's not approved for that age group. And I think a lot of our youth sports is within that age group. So it is prudent to continue to wear a mask. And the kids have been adaptable, right? Like we had talked about. I mean, they've been so good about it. So I think that we worry more about them running around in the mask than they do. They seem to be pretty good with it and not really making as much of a fuss as a lot of the parents are.
Completely agreed. The only exceptions to that would be swimming and, as of right now, gymnastics, where they could get caught on a piece of apparatus. But otherwise, masks are still the recommendation at this point for all other sports, indoor and outdoor.
And that's also a good point, Dr. Lynch, that if the mask is wet, then it does make them harder to breathe. So if you have that sweaty kid, especially the preteen, that's their hormones are just starting to kick off, it's good for them to have a few extra masks in their bag so that they can change into a dry mask and make sure that they're not running around with a wet mask. Okay, Dr. Edinger, the next one I'm going to shoot off to you. So if the kids are taking off their masks for recess and lunch, what's the best way for them to keep their mask contamination free?
So the main thing is definitely developmentally appropriate. So different ages, different things, but really focus on trying to get them to touch only the ear loops and folding out, like so they close to the inside facing part. So, and I think a lot of people have been practicing this at home and last year a bit. And then either whether they're putting it on their desk, which I know some people do, or if they have a longer activity, like if they are going to go do something where they're going to be off, mask off for a while, like maybe packing a Ziploc bag or in the cubbies. So they get practice kind of not touching the insides of the mask.
Perfect. Thank you. Okay, Dr. Pillen, this may put you on the spot a little bit. This is one of our online questions. Is there a gentle way to ask a coach or instructor if they've been vaccinated?
Well, I tell you what, it is always touchy. And I know that especially in many of these social situations, we want to be very careful, be respectful of folks. So my tendency is to say, approach this as a we issue. Instead of asking somebody directly, did you get vaccinated? Just talk to them about, hey, I'm really concerned. I want everybody on the team or in the class to be healthy. I want to know, if you've been feeling the same way. Have you taken some steps to help everybody, not only yourself, but the children involved? And I would frame it that way. But if you really need to know, then I would ask about that and be direct about those sorts of things, right? Knowing that you don't want to be disrespectful or polarize around this. It is a health and welfare issue. It's a safety issue. And I think that's the universal that I would always lead with.
Great advice for sure. Okay, and then the next one I can take, someone had asked about how many hospitalizations we've had in children with COVID since March of 2020. And so from March of 2020 up until July of 21, we've had 22 hospitalizations for children under 18. So it's not zero. We still want to be safe, but we just wanted to make sure that that question got answered. And then this one also, I guess, Dr. Pillen, we'll start with you, and then I think everyone should chime in on this one. So as of today, it seems like the DOE is going to delay fall sports into the end of September. So, and they're looking to get all the student athletes vaccinated. So is there a way for parents to talk to their kids about this? Because this is definitely going to have an effect on their mental health, that they were so excited to go back and now it's being delayed again.
So clearly a disappointment. We all, I think everyone who's been going through this pandemic are eager for things just to be normalized. So that's certainly true for kids who might be a little bit more impatient and they really feel good as an athlete or as a student, for example, right? So I would recognize that disappointment and recognize that that's not the end of the story, that throughout this whole experience, what has really helped people are consistent actions to stay safe, but also adaptability. And that the more adaptable we are, the better we are. And I might even use, I'm not much of a soccer player, for example, but I imagine playing soccer, you have to be adaptable on the field, right? If the play is changing, you have to be able to respond and kind of think ahead of time. So I would encourage students and athletes to be thinking about, okay, how can you use this not only to prepare mentally, but then to prepare your body as we get back to sports and normalize. We'll get there.
Dr. Lidge, do you have any comments?
It's as has been pointed out, that's a complete bummer. We're totally bummed out on our side as well. And yet it's not like this is going to result in a end of the line missed opportunity. There may be even new opportunities here. It's hard to put an absolute positive spin on this, but we're all going through it together. And just because it is in fact football season, with the prevailing changes in the Delta variant, the time may not be right. I hope that we are able to get back and make something of the fall season here, but we have to take into account that there are still hospitalizations. There are other concerns that are going on here, and that we're all going to go through it together. There may be new opportunities that come out of it.
Great. And then Dr. Edinger, anything else you wanted to add?
The only thing is I could say maybe, is it a way for you to get active with your child? I don't know if it's another way for you to say, hey, let's train together. Show me what you would do. Because again, so many of us need more opportunity to exercise as adults, and the kids that are so excited are so committed. And so let them shine and maybe join in on their world a little bit, train with them. I just want everybody to get in it together a little bit more. So maybe there's an opportunity there.
I love that.
Yeah.
Absolutely. And then maybe even building that camaraderie, because even, in the spring of 2020, like the kids that lost their graduations and lost their proms kind of found creative ways to still get together and manage to make something of the end of their senior year. So same thing probably for the sports. If the teams can kind of get together and still support each other, that can be helpful as well. Okay, and then I guess the final question we'll talk about is we did have someone ask if there's any tips or things that you could say to families that are hesitant about vaccines. So for instance, you have one family that is vaccinated, but another family is hesitant. Is there a way to kind of, give them some information that it doesn't seem to be you're lecturing them about being vaccinated? Dr. Pillen, do you want to start?
Yeah, this has been really difficult. There's been a lot of debate about this. And what we do know from a psychological standpoint is if you're challenging, people will polarize and they won't listen. They will, in fact, kind of not consider your recommendation to get vaccinated or take steps with masks and such. And I think that, for the people who are merely hesitant, then listen and find out, well, what are the obstacles in the way for you? If you felt comfortable somehow about getting this vaccine, would it be FDA approval? Would it be more convenience? How many more people do you need to know before you feel secure in this? But ultimately, with the people who are much more resistant, what we know is that it's a personal appeal, and you express concern. I don't want you to be ill. My friendship, you are a family member, you are too important for me to stand by and not express how much I want you to be healthy and well. And I think that that's the sort of thing that will ring in their ears a little bit more than all the studies about the vaccine.
No, that's great advice. Okay, we are hitting 1 o'clock. So I definitely want to give a big mahalo to our panelists who took their time today to share their expertise and provide insights for our viewers watching at home. We hope that you were able to take away some helpful information to help your Keiki safely reintegrate to both sports and school. As you have heard throughout today's program, Hawaii Pacific Health offers comprehensive services that can support the medical needs of you and your family. From virtual care via video or phone or in-person visits, we are here to keep you and your ohana healthier. If you have any questions regarding our services or today's webinar, feel free to visit hawaiipacifichealth.org. And thank you for joining us today. We hope that you stay safe and healthy. Mahalo.
Bye-bye.